I want to start with Elon Musk's announcement. It was a post, not surprisingly, on X, the former Twitter, which he owns. He said, the first human received an implant from Neuralink yesterday and is recovering well. Initial results show promising neuron spike detection.
Have we cracked the neural code? Imagine controlling a computer directly with your thoughts. No more typing, swiping, or even speaking. Just a silent command from your brain. Science fiction? Not anymore. On January 29, 2024, the world took a monumental step towards merging technology with the human mind as Neuralink announced the successful implantation of their brain chip in a human patient. This isn't just another medical marvel. It's a potential paradigm shift in how we interact with the world, raising both thrilling possibilities and ethical concerns in equal measure. Are we finally on the cusp of an era where our thoughts have tangible power? What does this groundbreaking achievement mean for the future of human-computer interaction and our understanding of the brain itself? Let's find out. Neuralink, a company led by Elon Musk, has successfully implanted its revolutionary telepathy chip into a human skull for the first time. This marks a significant step in a 6-year study, aimed at making the technology safe and beneficial for individuals facing challenges like quadriplegia due to spinal cord injuries or conditions like ALS. In this early stage of the clinical trial, the first human recipient of the Neuralink implant is recovering well. Named Telepathy, the chip is designed to detect electrical signals from the patient's brain, specifically registering spikes in brain cell activity. The primary focus of the ongoing study is to assess the chip's effectiveness in translating neural signals related to limb movement for individuals with quadriplegia or ALS. The mechanism behind telepathy involves the insertion of a chip into the patient's skull, forming a direct connection with the brain. This chip aims to intercept neural signals responsible for limb movement and then transmit these signals to other parts of the body. The ultimate goal is to empower patients to regain control over their limbs. The significance of this technology lies in its potential to provide a breakthrough for people facing severe mobility limitations. For those with quadriplegia, or ALS, the ability to decode and transmit neural signals could mean a chance to move their limbs again, significantly enhancing their quality of life. Elon Musk shared the news on his social network, emphasizing that this accomplishment is just the beginning of a long journey to refine and optimize the technology. The first results from the implant show promising signs with recorded spikes in brain cell activity, indicating the successful interception and interpretation of neural signals. Neuralink's approach represents a fusion of advanced neuroscience and cutting-edge technology. The implantation of the telepathy chip into the human skull showcases the company's commitment to addressing real-world challenges and exploring innovative solutions to improve the lives of individuals facing neurological conditions. As the study progresses over the next 6 years, the hope is that Neuralink's telepathy chip will continue to demonstrate its potential as a transformative tool in the field of neurotechnology, offering newfound abilities to those who have long grappled with the limitations imposed by conditions affecting their mobility. Now, speaking of approval, Neuralink recently gained approval from the U.S. Food and Drug Administration for a medical test in 2023. Musk envisions going beyond this by creating a generalized input-output device that could connect with every aspect of the brain, essentially allowing people to link their minds directly to the digital world. This ambitious goal includes the idea of consensual telepathy, where individuals could send messages directly to each other's minds. However, the idea isn't entirely new. Anil Seth, a professor of cognitive and computational neuroscience at the University of Sussex, expressed skepticism about Neuralink's recent announcement. He mentioned that other groups have been working on brain implants for decades and have achieved more impressive results than what Neuralink has presented so far. Despite acknowledging the innovative installation robot developed by Neuralink, Seth emphasized the need for more scientific research in addition to engineering expertise in the field of brain interfaces. Seth raised concerns about the potential risks associated with brain-machine interfaces, stating that more precautions are necessary to prevent unexpected problems. He humorously referred to the term rapid unscheduled disassembly, a phrase used in aerospace engineering to describe unexpected events like rocket explosions. Seth's point is clear. Nobody wants such incidents happening inside their own heads. Elon Musk's ultimate objective with Neuralink is to establish a symbiotic relationship between humans and artificial intelligence, AI. This means achieving a seamless integration of AI with the human brain, allowing for enhanced capabilities and interactions. While the concept is undoubtedly futuristic and captures the imagination, it's essential to approach it with caution and thorough research. Now let's talk about the challenges Neuralink faces on its path to success. One major hurdle is gaining approval for medical studies in people with health issues that don't improve easily, as it's easier to get approval for such cases. Convincing individuals to implant a non-medical device inside their bodies poses a considerable challenge, requiring both technological proof and medical approval. Moreover, there are ethical and social concerns hindering adoption. Musk, a polarizing figure due to his leadership of Tesla and SpaceX, faces criticism for his controversial actions, particularly his takeover of Twitter, now named X. This has led to alienation from those who perceive him as anti-Semitic or racist, potentially impacting Neuralink's acceptance. Beyond these issues, the general public's discomfort with the idea of Neuralink poses another obstacle. While telepathy seems appealing, the reality of a Neuralink implant replacing a part of the skull raises concerns. The process is much more significant than routine dental procedures, and Neuralink has faced criticism from animal rights activists for issues like infections and loose implant attachment screws during tests on monkeys. Neuralink's ambitious goal to enable patients to control computing devices with their minds introduces a new dimension. Elon Musk envisions a future where individuals, like Stephen Hawking, could communicate faster than a skilled typist or auctioneer. However, achieving this goal requires overcoming technical, medical, and societal challenges. Neuralink's journey is fraught with obstacles. From obtaining medical approvals and addressing ethical concerns to dealing with public apprehension and potential backlash against Musk's actions, the company faces a complex landscape. The vision of mind-controlled computing devices is compelling, but the path to realizing this potential is paved with intricate challenges that extend beyond the realm of technology. But that's not all. Neuralink is also developing an app that allows people to control digital devices using their minds, essentially enabling them to type with their thoughts. They showcase this technology by conducting experiments with monkeys. However, the planned human trials initially set for 2020 are running behind schedule. In the realm of brain-machine interface, BMI, or brain-computer interface, BCI technology, competitors are also making strides. One noteworthy experiment aided a man in regaining the ability to walk. Another experiment in 2022 demonstrated a 250 electrode connection, enabling a woman to type at a speed of 78 words per minute solely with her mind. This breakthrough occurred as a computer learned to interpret the motor commands she would typically use for speech. Elon Musk, founder of Neuralink, had previously discussed such possibilities with Stephen Hawking, the renowned physicist hindered by ALS. Various companies are actively involved in the development of brain implants. BlackRock Neurotech has been conducting human trials with implants for several years. Paradromics is actively working on its implant technology, and Synchron Medical published test results for a communication implant in 2023. Precision neuroscience is focusing on less invasive implants, while Neuro is aiming to achieve success with non-invasive approaches that eliminate the need for surgery. In addition to these private companies, academic researchers are consistently contributing to the field with a continuous flow of research papers. Despite the delays in Neuralink's human trials, the overall landscape of brain-machine interface technology is advancing, with different companies employing diverse approaches. These developments hold promise for the future, with potential applications ranging from assisting individuals with physical limitations to enhancing communication through mind-controlled devices. The competition and collaboration within this field reflect a collective effort to unlock the full potential of brain-computer interfaces for the benefit of individuals and society as a whole. So what is Neuralink up to at this point? Neuralink is a company with a big idea. They believe that modern technology can understand and interpret the signals produced by our brain cells, known as neurons. By doing this, they aim to create a connection between our brains and computers, allowing for two-way communication. One exciting possibility is helping blind individuals see by sending signals from a camera directly to their visual cortex. To make this happen, Neuralink uses a special implant that consists of 64 threads, each equipped with 1,024 tiny electrodes. These electrodes pick up the electrical signals generated by the brain cells. What makes their approach unique is the R1 robot, designed to delicately insert these threads into the brain without disturbing the blood cells. The core of this technology is the Telepathy unit, roughly the size of a coin but thicker. This unit is implanted into a hole in the patient's skull and contains a processor responsible for managing communication between the brain and the external world. The fascinating part is that this unit communicates with the brain and charges wirelessly, eliminating the need for physical connections. Currently, Neuralink is in the early stages of testing this groundbreaking technology on humans. The company anticipates that the human trial will span approximately 6 years, showcasing their dedication to thorough research and development. It's important to note that the information shared here is for educational purposes only, and individuals should always consult with medical professionals for any health-related concerns. Neuralink is pushing the boundaries of what's possible by creating a direct link between the human brain and computers. Their implant, equipped with advanced technology and a carefully designed robot, aims to revolutionize how we interact with the world, potentially providing life-changing solutions for individuals with sensory impairments. The journey of Neuralink is an exciting exploration into the future of neurotechnology, promising new possibilities for human experience and well-being. But hold on, before we get too excited, there's a lot to think about. This is a brand new technology, and like any new invention, it comes with questions. Will it make us smarter, stronger, better? Or could it lead to problems like privacy concerns or unfair advantages for some? Let us know your thoughts in the comments section. Remember to subscribe to our channel if you found this content valuable.